Medicaid expansion continues to be a hot topic at the State House, and today a bill proposal that would add work training requirements to the law is causing some controversy. 6 on Your Side's McKenna King speaks with one of the bill's sponsors who believes restrictions to the expansion of Medicaid stays true to the will of the people.
It's a law our neighboring states have implemented very recently. Montana funded Medicaid expansion with a tobacco tax increase and Utah with a sales tax increase. What Proposition 2 lacked here in Idaho was a way to fund the program, which is why the issue has been one with different funding suggestions and intense debate at the legislature this year.
74% of voters want the legislature to implement the Medicaid expansion law as it was passed by the voters.
That's according to a GS strategy poll recently conducted to reflect Idaho's voter population, which supported the expansion of Medicaid in November with more than 60% of the vote. What the poll found voters don't want is millions spent on a work requirement program.
We could refer people who participate in Medicaid to workforce training programs that will help them get some sort of certification, help them improve their job search skills.
Something Representative Brian Zollinger says his proposed bill would do.
The objective is to help people get the training, encourage them to go to college, vocational training, and help them progress in life and be able to afford the health care, move out of the Medicaid population.
Not yet introduced at the State House, it's a proposal that would add work, train, volunteer requirements to the Idaho Medicaid expansion law.
The misperception, this is not requiring work. It's 20 hours a week, so they have time to take care of family or whatever their other duties might be.
There are exemptions to those requirements for some populations. Cost for the program, however, is still a bit up in the air, but the bill would support using a similar setup to the SNAP program.
Numbers are out there anywhere from $400,000 to $2 million. I think that's going to be on the lower side, perhaps even lower than $400,000, because we're using the current infrastructure. We're not creating any new regulation that the Health and Welfare has not already dealt with.
The legislature's budget setting committee made the decision earlier this week to fund Medicaid expansion using Idaho's Millennium Fund, dollars that have typically gone to help nonprofits across the state. And now, without money in that jar for those organizations to pull from, options to hire employees are going to be limited, something Representative Kingsley hopes will be eased by one of the requirements.
This work requirement where people, well, part of it that they can volunteer, it's really going to help our nonprofits that are going to be missing money in the Millennium Fund.
Now, funding for this bill is not available this year, so if passed, it would take effect in 2020. At the State House, McKenna King, 6 on Your Side.